Stroke. Oftentimes a sudden occurrence that knocks its victims out of functionality and catches them unprepared. Today we examine how this neurological condition strikes, its possible causes, symptoms and treatments from an expert lens as we commemorate World Stroke Awareness Month this May. Can you please give us a proper medical definition of stroke?
Stroke is the common word that is used for cerebrovascular accident, CVA, cerebrovascular accident. And it may involve bleeding into the brain. It may involve blockage of vital vessels into the brain and may also cause neurological issues and problems. It may cause unconsciousness in the patient. It may cause inability to either move the hands and legs or the hands or the legs.
Can you tell us the causes of stroke? Like what really causes it actually?
Stroke may be caused by so many things or so many factors. Some of the commonest causes of stroke include high blood pressure that is not properly controlled or is not being controlled. It may also be caused by blockage in the blood vessels of the human body, especially the ones that supply the brain, the heart, and other vital organs of the body. Stroke may also happen in patients with background sickle cell disease or what you call hemoglobinopathy. It may also be a complication of diabetes mellitus, wherein the blood sugar that's not controlled may bring in complications affecting some vital organs like the brain, like the heart, like the kidneys, and other vital organs in the body. Stroke may also be caused by just blunt injury, specific injury, for example, to the head injury. It may be a result of hitting the head against something or through road traffic accident. Because of metastasis or the seeds of the cancer cells that are being sent to the brain, it may cause stroke. So in which case, ordinarily, even people with cholesterol that is not, or lipid or cholesterol that is not properly controlled in the blood or body system may invariably lead to stroke. So stroke may just be a complication from a pre-existing organic trouble.
What are the symptoms of stroke in a patient? How do you identify that this patient has stroke?
First of all, there may be some form of sleep disturbance. There may be weakness in lifting or moving either part of the right hand or the left hand or left arm or right arm. That's upper limb or lower limb. It may be right-sided or left-sided. There may also be bending of the mouth or switching the mouth or the lips to either direction, not being straight, not being symmetrical. There may also be features of inability of the person to express formation of wrinkles on the forehead. There may also be features, you may see even features of somebody who seems to have been bleeding or bled into the hind of the eye.
So this brings us to the question, at what age what's the earliest age you can have stroke?
With or without the age, somebody who is involved in a road traffic accident, for example, irrespective of the age, person can develop stroke. So like all the constitutive factors I've mentioned before can predispose anybody to stroke.
Can a person fully recover from stroke? Is it possible to have a full recovery after stroke?
It is possible to recover from stroke. Stroke comes in different formats and different strides. For example, if it's mild stroke and it is covered on time with simple physiotherapy, medication to correct the risk factors, for example, maybe like blood pressure control, diabetes control, and other things, somebody can recover from stroke completely and fully. So especially if no major damage has been done.
Any final thoughts, what you have to say to people out there, probably people experiencing stroke? Your final thoughts on the subject matter?
People should take responsibility most of the time for their own health. As much as possible, avoid accident, especially head injury. It's not really safe. Even at childbirth, for example, we should be careful, even those of us who are health workers, the way we deliver babies, to make sure we don't give them fracture, we don't damage their nerves and things like that during the course of delivery. And apart from that, once we begin to see features or signs and symptoms that pertain to stroke, or that is making somebody to feel that this person is getting predisposed to stroke, the best thing to do is to seek the help of a caregiver. At least seek the help of a doctor.
We've heard from a medical expert on the triggers, symptoms, and treatment of this condition. Now we'll be listening to a man who narrowly escaped the fatal blow of stroke as he shares with us the journey towards recovery.
About 7 or 8 years ago, I live in Michigan, United States of America. I just woke up that day, started seeing some funny thing. My system is somehow freezing because of cold. At the end of the day, I'm seeing myself with a little partial stroke. Started battling this and that, you go to hospital, this and that. My children take me up and down. Later, my daughter now said, Daddy, you better go home. Oh. This is your problem. This place, they'll just give you injection and just take care of you partially. That's when I decided to come to Nigeria. When I come to Nigeria, go to hospital, do this, do that. And that time, I can't even talk. I can't talk. They'll just take me in. I can't talk whether it's hot or cold. I don't even know anything. When it gets to about 3 months, I started coughing. When I cough, I'll bring out a very heavy blood from my mouth. Getting to 3-4 months, when the blood is coming out, I started talking little by little. But glory be to God, getting to 6 months, I started standing from the chair using crush. Working with crushing. So if I'm coming and they drive me down, I'll come down and use no more wheelchair. About 8 months, I leave one crushes, started using only one. Before 1 year, I leave everything, leaping, managing myself. And I didn't use anything except supplement. Apart of the supplement, I did not use nothing. No babalawo, no any juju, massage, supplement, and steam bath. Nothing but that. For past 7 years to 8 years. This is where I am today.
This tragic incident of stroke over time has left its victims with scars, memories, and sometimes a huge loss. This is the story of a young lady who suffered the loss of her father, but came out strong with a message to tell.
I can't remember exactly when it started, but I remember my dad had diabetes and high blood pressure for a very long time. When I was in the university, I think to me, I thought it was still the diabetes. It got worse. There was a day my mom called and said my daddy was not feeling fine and he was taken to the hospital. Before I knew what was happening, it became so bad. The day I came back from school, I saw my dad and he wasn't really looking the way I remember him. He started shedding weight and he didn't really talk much. The fact that he was just lying down there and my mom told me that we shouldn't disturb him, that he needs to rest. I knew that something was wrong. My mom said that the doctor said it was stroke, partial stroke, and the oxygenated blood was not being carried around his brain properly the way it's supposed to. Because when I came back home, my daddy was totally a different man. He was basically a baby. You have to do everything for him. Sometimes he would just start crying. I don't know, sometimes he might start saying things that doesn't really make sense. I think it was more than a year that it happened. And Because of the partial stroke, or part of his body, he doesn't feel anything. Some parts of his body, let me say half part of his body. So we employed the physiotherapist that was living in the house with us. In the morning, he had to do some exercise with him and stretch those parts of the body. And from wherever you are in the house, you can hear my dad screaming, crying out of pain. On the 9th of June 2019, yeah, and my mom called, my brother called me to ask me about my exam, and I had exam that day. That was when he told me that my dad had passed. Up until his death, to me, I didn't really understand the pain of losing somebody until he passed. And after my exams, I came back. He was not around. I don't know, perhaps it just felt odd. It's never the same since his passing. My advice to anyone out there who has stroke or is experiencing symptoms of stroke is to go and see a doctor. Because once it keeps compounding, the result is always catastrophic. You will end up in the hospital and there might be little to nothing that they could be able to do to help you.
With the current prevalence of stroke in Nigeria as 1.14 per 1,000 and a 30-day case fatality rate as high as 40% according to PubMed, it is pertinent not just to take the necessary actions to avoid such illness, but also to commence treatment as soon as detected. Happy Stroke Awareness Month from GuardianTV. Do drop your comments below and remember to like, share and subscribe to this channel for more insightful coverages and reports. If you are watching for GuardianTV, stay tuned.